The 20th century marked a pivotal moment in the history of medicine, driven in large part by the pioneering efforts of Harvey Cushing, often regarded as the father of modern neurosurgery. His work not only advanced surgical techniques, but also redefined the role of the neurosurgeon as both a scientist and clinician. Dr. Harvey William Cushing was born on April 8, 1869 in Cleveland, Ohio, the youngest of 10 children by Henry Cushing and Betsy Williams. He descended from a distinguished lineage of physicians, spanning 4 generations, which included his great-grandfather, grandfather, and father, all of whom were esteemed medical practitioners. Harvey Cushing's early education involved him attending Central High School of Cleveland. It was there where he was influenced by physics professor Newton Anderson, known for encouraging Cushing's craftsmanship. Cushing's interest in science was sparked in the summer of 1884 when Anderson led a fishing expedition to Lake Sault Ste. Marie. His professor began offering manual training classes to local boys every summer, an initiative that soon developed into the Cleveland Manual Training School, where Cushing enrolled and thrived. After completing his early education, Cushing was admitted to Yale University, where he earned his Bachelor of Arts in 1891. He then went on to pursue medical studies at Harvard Medical School, graduating with his medical degree in 1895. Diving headfirst into his career, Dr. Harvey Cushing began as an intern at Massachusetts General Hospital in 1895. As an intern, Cushing was able to observe and understand the impact that German physicist Röntgen was able to make on the newly discovered X-ray technology. Within 3 months of its discovery, Cushing had secured the X-ray technology at Massachusetts General Hospital for outpatient use. Early in his medical career, Cushing was able to apply his knowledge by inventing a pneumatic cranial tourniquet, which allowed surgeons to make bloodless incisions, greatly improving surgical precision and reducing mortality rates. Cushing was also able to develop new surgical techniques, such as the use of silver homeostatic clips for controlling intracranial bleeding, as well as advocating for the strategic use of manual pressure and chemical agents. This transformed surgical management protocols and significantly improved patient outcomes for neurosurgery. These contributions dramatically reduced the operative mortality rates during brain surgery, which was thought to be nearly impossible at the time. In the laboratory setting, Cushing was known for his fiery temper and his perfectionist personality. His apprentice, Dr. William Sharp, stated that he drove himself mercilessly and expected the same of his assistants. Sharp stated that during one occasion he was so angry, he grabbed Cushing by the neck and went to punch him, but regained his composure. Although Cushing was seen as a ruthless mentor, he is often attributed as one of his greatest assets in his pursuit of knowledge. Cushing's contributions to medicine extended well beyond the operating room. Fascinated by the body's communication systems, he focused his research on the pituitary gland, a tiny yet crucial component of the endocrine system. In 1912, he published his landmark text, The Pituitary Body and Its Disorders, which laid the foundation for endocrinology. In it, he introduced the concepts of hypopituitarism and hyperpituitarism, linking hormonal imbalances to disorders like dwarfism, gigantism, and later, a unique syndrome. Disaster struck when World War I broke out in early 1915. As a response, Cushing headed the first unit of 13 Harvard surgeons and 4 nurses called the American Ambulance. After spending years serving in the war effort, Cushing was eventually assigned as a senior consultant in neurological surgery for the American Expeditionary Forces in Europe. When World War I ended in 1918, Cushing had been recognized as a Companion of the Order of the Bath by the British government and received the famed Service Medal from the U.S. Army. Cushing's syndrome, which Cushing first described in a 1932 publication, detailed symptoms resulting from overstimulation of basophilic cells in the pituitary gland. Symptoms listed were weight gain, hypertension, and characteristic fat distribution, highlighting a profound connection between pituitary tumors and systemic hormonal disorders. Cushing's discovery enhances the understanding of endocrine pathology. Through his life, Harvey Cushing meticulously documented his findings in over 300 articles and 13 books, combining surgical precision with artistry. His hand-drawn anatomical illustrations not only supported clinical diagnosis, but also served as valuable teaching tools. His dedication to the broader understanding of medicine extended beyond the operating room. He was awarded the Pulitzer Prize for his biography of his close friend, Sir William Osler, a work that highlighted Osler's enduring influence on health and human sciences. In recognition of his groundbreaking contributions, Cushing received numerous honors, including the Joseph Lister Medal in 1932 from the Royal College of Surgeons of England for distinguished contributions to surgical science, and the Henry Jacob Bigelow Medal in 1933 from the Boston Medical Society for a significant impact on the advancement of surgery. As an educator, Cushing established the Hunterian Laboratory at Johns Hopkins to train young neurosurgeons and founded the Harvey Cushing Society, which would evolve in today's American Association of Neurological Surgeons. His tumor registry at Yale, along with his vast collection of preserved brain specimens, still serves as a resource for medical scholars, reminding us of the hands-on curiosity that propelled his work. Harvey Cushing passed away in 1939, but his works for the field of health sciences still stand as a foundation for neurosurgery performed today. His legacy has ensured the continuity of neurological studies and research for decades and centuries after his death.